Which of the following is not an opioid? Answer is acetaminophen. Which of the following is not a behavioral indicator of pain? Answer is decreased hand and finger movements. Populations vulnerable to under recognition and under or over treatment of pain are the following except answer is adults. Which of the following statements about acute pain is false? Answer is usually has no protective function. Non-pharmacologic therapies. Answer is utilizes ways to alter thoughts and focus concentration to reduce pain. Which term would the nurse use to document pain at one site that is perceived in other site? Answer is referred pain. Regarding pain, all the following descriptors are applicable except answer is always associated with the actual tissue damage. Which of the following activities is not correct related to maintaining the patient's environment devoid of pain? Answer is patient is pulled to be lifted in bed. The characteristics to be assessed in pain are the following except answer is family history of pain. The inhibitory neurotransmitters of pain are answer is endogenous opioids serotonin. Which statement represents the best rationale for using non-invasive and non-pharmacologic pain control measures in conjunction with other measures? Answer is these measures potentiate the effects of analgesics. The nurse is alert for sympathetic responses to pain such as increased blood pressure, increased pulse, increased respiratory rate. Which term would the nurse use to document pain at one site that is perceived in other site? Answer is referred pain. The single most reliable method of assessing pain intensity is answer is self-reporting of pain. The nurse instructs the client taking ibuprofen that the drug is effective for pain relief because it acts to reduce inflammation and black prostaglandins. Ryan underwent an open reduction and internal fixation of the left hip. One day after the operation, the client is complaining of pain. Which data would cause the nurse to refrain from administering the pain medications and to notify the healthcare provider instead? Answer is left foot cold to touch, no palpable pedal pulse. Which term refers to the pain that has a slower onset, is diffuse, radiates, and is marked by somatic pain from organs in any of the body activity? Answer is deep pain. In caring for a young child with pain, which assessment tool is the most useful? Answer is Faces Pain Rating Scale. Upon entering the room, the nurse discovers that the client is experiencing acute pain. An expected assessment finding for this client is diaphoresis. When evaluating the pain of a 50-year-old woman who has just had her gallbladder removed, the most important characteristic to consider when assessing her immediate postoperative pain would be answer is pain severity. Transmission is answer is the communication of painful stimuli to the brain. Which of the following is not a behavioral indicator of pain? Answer is decreased hand and finger movements. Kreis scale is used for evaluating pain in answer is neonates. There are various types of pain, acute and chronic. How long does pain have to remain for it to be considered chronic? Answer is more than 3 to 6 months. Which of the following is not a unidimensional Which of the following is not a unidimensional assessment tool for pain? Answer is brief pain inventory. Which of the following statements about nociceptive pain is false? Answer is caused by a lesion or disease of the somatosensory nervous system. A family member asks you, why can't you give more medicine? He is still having a lot of pain. What is your best response? Answer is, please tell him that I will be right there to check of him. Unborn babies experience pain by dash weeks of gestation. Answer is 20 to 26 weeks. Which non-pharmacologic pain relief intervention should the nurse include for post-surgical and procedural pain control? Answer is transcutaneous electric nerve stimulation. The nurse on a post-operative care unit is assessing the quality of the client's pain. To obtain this specific information about the pain experienced from the client, the nurse should ask, answer is, how much does it hurt on a scale of 1 to 10? A delta fibers, answer is, carrying information about brief short pain. The characteristics of pain that are unique to every individual are, answer is, all of the above. Pain tolerance and pain perception and expression of pain, all of the above. The nurse caring for a client with suspected appendicitis knows that the pain associated with appendicitis is, answer is, visceral pain. The type of fibers conducting visceral poorly localized pain or, answer is, type C fibers. How is the pain classified based on intensity? Answer is mild, moderate and severe. Non-pharmacologic therapies, answer is alters thoughts and focus concentration to reduce pain. Regarding pain, all of the following descriptors are applicable except, answer is, always associated with actual tissue damage. Which non-pharmacologic intervention is difficult to use with the older adults who are cognitively impaired? Answer is guided imagery. Neuroablative procedures such as cordotomy are most commonly used for treating, answer is, intractable cancer pain. Neuropathic pain is, answer is, related to anatomic and biochemical changes in the nervous system. Nurses working with clients in pain need to recognize and avoid common misconceptions and myths about pain. In regards to the pain experience, which of the following is correct? Answer is, the client is the best authority on the pain experience. When evaluating a client's adaptation to pain, which behavior indicates appropriate adaptation? Answer is, the client distracts himself during pain episodes. Pain conduction can be modified by all of the following except, answer is, providing anticipatory teaching on pain management. A 12-year-old student falls off the stairs, grabs his wrist and cries, "Oh, my wrist, help! The pain is so sharp. I think I broke it." Based on this data, the pain the student is experiencing is caused by impulses traveling from receptors to the spinal cord along which type of nerve fibers? Answer is type A delta fibers. Which of the following is most appropriate when trying to determine the intensity of your patient's pain? Answer is offer the client a pain scale to objectify the information. In the FLACC pain assessment scale, A stands for activity. The nurse tells the client that the urinary catheter insertion may feel uncomfortable. This is most accurately an example of answer is anticipatory teaching. When treating moderate to severe cancer pain, answer is all of the above. Assess the frequency, duration, occurrence, etiology of the pain, and use sustained released opioid in on around the clock fashion. Titrate opioids based on the response of the patient. Answer is all of the above. Populations vulnerable to under recognition and under or over treatment of pain are the following except answer is adults. We can think of nociceptive pain is termed of answer is all of the above. Stimulation, transmission and perception. The client tells the nurse about a burning sensation in the epigastric area. The nurse should describe this type of pain as answer is deep visceral. Muscular pain is a type of answer is none of the above. An 85-year-old male patient with a history of prostate cancer and metastasis to the lumbar spine is receiving methadone dolophine 10 mg 3 times a day. The patient's spouse tells the pain management nurse that the patient exhibits a lack of motivation, loss of appetite, and an inability to get out of bed. The nurse initially focuses on the patient's answer is pain assessment. The characteristics to be assessed in pain are the following except answer is family history of pain. Which of the following statement of somatic pain is false? Answer is generalized pain. The inhibitory neurotransmitters of pain are answer is endogenous opioid serotonin. Which of the following statement related to pain is false? Answer is pain is objective. Which of the following statements about acute pain is false? Answer is usually has no protective function.